I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Again, welcome to tonight's meeting. At this time, we have a presentation by the Madison County Health Department. Ms. Barnhill.
Miss Albritton.
Ms. Albritton, sorry. I'm sorry.
Good evening. It's nice to see each of you tonight. Good evening. So Ms. Joseph has asked me to talk a little bit about the processes that we're using in the schools to isolate COVID students. But first, I want to start out with a little update on the COVID situation in our community. Right now, we have a total cumulative cases of 3,271. Of those, 46 are non-resident cases, leaving 3,226 total cases of Madison County resident cases. Our trends over the last 7 days, we've had 109 positive cases. Over the last 14 days, we've had 331. All right, can y'all hear me now? Thank you. Did y'all hear the last figures that I gave out?
I heard them, and it was just
I heard it, but it was.
Okay, so the last 7 days, our positive cases are 109. And in the last 14 days, the positive cases have totaled 331. We're beginning to see a slight decrease in the number of cases, and I'm hopeful that this trend will continue. Our numbers over the last 4 weeks have been way more than what we saw when we first initially had COVID. So we have been working very hard to try to contain the spread of the virus. Our positivity rate is hovering around 18 to 20%, and that's high. We'd like to see it less than 10%, and actually we'd like to see it less than 5%. But this is a trend across the states, and so Madison County is not immune to having a high positivity rate.
Ms. Albritton, the numbers you're giving us for the county as a whole, not just the school system.
No, this is what we're seeing in our community as a whole, not the school system. So our vaccination availability and trends are in Madison County, the individuals over 12 years and older, there's 45% of our population that has been vaccinated. We have those individuals that are ages 12 to 19, 27% of those have been vaccinated. As of September 2nd, 7,697 Madison County residents have been vaccinated. This includes 1,737 first doses only, and 5,960 residents who've completed the series. And at the health department, we have fully vaccinated 3,170 of the 5,900 cases. At the health department, we do have testing available, and you can come in, walk in, it's by appointment or walk-in, and you can also obtain services for vaccinations on a walk-in basis or by appointment as well. We also have increased testing availability and access in our community, where we have a private provider we've worked with to come into Madison County so that our students and community members can have increased access. And we have testing available Monday through Saturday from 9 a.m. to 6 p.m. at the Van H. Priest Auditorium. We're now beginning to administer third doses to those individuals who are immunocompromised, and then our booster doses will begin September 20th.
Is that for both vaccines or just the Pfizer? Or?
It's for Pfizer and Moderna.
Okay.
There is no booster or third dose for the Johnson & Johnson, the J&J vaccine at this time. So I'm gonna pause right there. Do we have any questions about what our community trends are? All right, so the process that we're using in the schools, it's going to be, we were very overwhelmed to begin with at school. Not only was the schools and the school district, as well as the health department, with the number of cases we were seeing in the very beginning. So we had to revamp our processes, and I think now we have come to a point to where we are operating efficiently and in the best manner that can best serve the schools. When we, the health department, or the schools find out that there is a positive individual in the school, they immediately contact Annie, who is our school health coordinator. And if she learns of a positive within the school, she immediately contacts leadership at the school leadership, the principal at that school. The principal at that school then begins contact tracing. There is a checklist that they use to be able to identify who the close contacts were. Once that is complete, they provide all that information to us, who the contact individual is, as well as the number of contacts that they've had. And we hope that that is before 2:30 every day, so that we can hurry and get this information out to the students. We run and we take those names and we create letters for every one of those students. There are times where there's 100 students at one time that we're having to create these for. So the intent is that every student goes home with a letter that details what their options are for return to school. And it depends on whether that student is symptomatic or asymptomatic as to what their options are. And I'm sure you've all seen the decision tree that DOE has put out, as well as the new rule that has been issued by the department.
Each one of them have one of these at their desk.
Okay. So with this, every student is given a letter. And so if the child is asymptomatic, which most of the children that are close contacts are asymptomatic, they do not have any symptoms, they have two options. They can return after he or she has received a negative test at least 5 days after the date of exposure with an approved test obtained on day 5. So after day 4, so the test has to be obtained on day 5. And if you're asymptomatic, the test that there are certain tests that are approved for those individuals that are asymptomatic. A rapid test, a buy next now rapid test, is not acceptable for someone who's asymptomatic. Those are designed to only test those that are symptomatic. So that has caused a little bit of an issue within our community of parents understanding the intent of what a PCR and a rapid test are for. So if the child is asymptomatic, there is a list that we have, and this is also given to the parents. There is an entire list of those antigen tests, which are rapid tests that are acceptable, and those PCR, which are molecular tests that are acceptable. There is only one rapid test that is an antigen test that is acceptable, and that is the Ellume for those that are asymptomatic. To my knowledge, we do not have Ellume in this county. Some individuals may be able to secure this, but for the most part, this is not available in our community through the testing at NOMI at North Florida, through our testing, or through Little Pine Pediatrics. So no other private provider that I'm aware of has this test at this time. So what they have to use is a PCR test, and that's what's available in our area. And that is the test that gets shipped off, and within 24 to 48 hours, the test results are then texted to the individual, or either they get a phone call. So that's the option for day 5. And then if they do not test, then the student is able to return after 7 days have passed since the date of exposure to the positive individual. So 7 days have to pass and they can return on day 8. And then if you're symptomatic or you have tested positive, there are 3 options for the student. They can return after he or she has received a negative test and is asymptomatic, not showing any signs or symptoms. Or after 10 days have passed since symptom onset or the positive test result. The student has to have been fever-free for 24 hours, and the student's other symptoms have to be improving. So they would return on day 11. Or if they are released by a medical professional or healthcare provider that is a licensed medical doctor, osteopathic physician, or an advanced practice registered nurse. So if they have written permission from either of those disciplines, then they can return. Do I have any questions on those options for students to return?
Yeah, let me ask you on number one, it says students, so if they're asymptomatic, they receive a negative test 4 days after date of exposure.
It is after 4 days, meaning on day 5.
On day 5. But now if you can't do the rapid test, so on day 5, you take the test, you don't get the results till day 7.
Close to day 7.
So you're not really saving any time that way.
Correct. And it's based on the availability of the test. This is not a local decision, this is a statewide decision.
Okay.
There's no local decision-making that has been put into any of these policies or procedures here.
Yeah, I get it. I mean, it's just practically, if you don't have a rapid test that's
Right.
acceptable, you might as well wait
Correct.
7 days because
Right.
you're not saving any time.
Right. And we have worked with Little Pine Pediatrics. We're all on the same page, and they have this, they have this document actually taped up in their office. And I've actually met with them at their facility and reviewed this with them and discussed what our testing practices are and what testing is available in the community and what's acceptable and what's not. And so they're on the same page, and they made the exact same conclusion. So the student, and what we do is we write in here what their day 5 and what their day 8 day of return, depending on the option that the parent selects. So they know what day that they should return. So those days are already pre-populated. So this is, in fact, it tells them how long they need to quarantine, and then it also lets them know when they can return. And by issuing this before the student leaves campus and the parents come pick them up, they have this. They have the testing sheet, the allowable test that goes along with this. We also provide them information on community testing at the health department and what else is going on in our community at Van H. Priest Auditorium, the dates and the times and what tests can be obtained. Just to give you a little idea of the number of tests that we've been performing at Van H. Priest, there's been a total of 1,272 tests performed, and that has been since August 25th. About 645 of those tests have been rapid tests, and about 40% of those rapid tests have come back positive. So we're seeing a high positivity rate, therefore, again, but we're also identifying, because we do have the rapid test available for those that are symptomatic, we are available or able to identify these individuals early and keep them from, impacting other students and teachers at the school. We also offer testing directly at our school sites, and I know that's at the high school and at the central school, and I'm not sure what our other schools are doing, but I know that at the 2 largest schools, at the high school and the central school, we have rapid tests available to test students before they leave campus with parental permission. So to date, the number of positive students in the district have been 156 positive students, 21 positive staff, and there have been 1,178 approximate quarantines.
What was the last number? The
On positive staff or the quarantines?
Quarantine.
quarantine?
1,178. So approximately 40% of the student body has been isolated. Now, in the 156 positive students and the number that was quoted, the 1,178 quarantined staff or students. Those numbers cannot all be contributed to what's happened on school campus. A lot of the positivity that we're seeing is coming from home or from community spread. It's not coming from within our schools. So of the 1,178, these could be students that are quarantined because of home contact or contact with a community member. Also, of your 156 positive students, the same scenario is included in this.
Would
Also-
it be safe to say some of these numbers are duplicated?
Yes, and also of the 1,178 quarantines, some of those were quarantined who later turned positive. So I think what we're seeing in our school district is not much difference than other communities that we're seeing. Each community is different. Each community is experiencing a different level of spread within their county. I think Madison got a good jump start on that, and I think we saw an early peak, and we're starting to see the numbers slowly decrease, and I hope that they will continue to do that. I'm trying to think if there's anything else that I need to say. Is there anything else, Ms. Joseph, that you'd like for me to cover?
Thank you.
I know that we work very hard to provide accurate information to the school district on the number of students that have been quarantined. Those individuals, we provide that to them so that we can make sure that they don't come on campus. There are times when in the evening we've had to identify 150 students that have been impacted, and we may not be able to get all of them. My people work 8 to 5 just like everyone else. Even if we alternate schedule, I still do not have enough staff to go through and contact those throughout the night. So it's very important that the school staff have that information to be able to assist with preventing them from coming on campus and to reduce the risk of further spread. We've worked very closely with the school district. We have a great working relationship. I'd have to say we've met at least once to twice weekly since the end of summer to be able to prepare for this. There's no way to prepare for this level of activity that we've seen is unprecedented this year, and I truly hope that next year is much better and that we don't have the changes in the quarantine and isolation requirements the day before school starts, so that we are much better prepared.
Do we know the numbers of the kids that are eligible to be vaccinated that have been vaccinated? Or is
Yes, I'm sorry, we do have that. We have.
You may have said it and I missed it.
I did say that. Those that are ages 12 to 19, we have 27% of those that are fully vaccinated.
And those are kids in the county, not necessarily in the
Correct.
school system.
They're individuals that reside in our county, whether they go to your school system or not. And the same thing for the 45% overall total population.
The figure of 156 positive, when is that cutoff? What's the cutoff date for that?
That's since August 6th, from the beginning of school.
So the beginning of
And
school
that,
through
the cutoff through today.
through today.
So we don't have 156 cases then?
No,
Many
you've
of
had
them
a
are probably-
total, since the beginning of school, 156 cases. And what we do is we report tomorrow today's activity.
And that's the same with staff also?
The staff, yes, and that staff, the 21 staff that have been positive, have also since the beginning of school, August 6th.
Of the 156, do we have the data of like if they were symptomatic or asymptomatic?
We do, and that is in our Merlin, our system, and but that takes a lot to pull out. It's very laborious to be able to pull that information out. I would say, just based on the number of discussions that I've had with those at the central school and at the high school and James Madison, the majority of these individuals are not symptomatic.
They're not symptomatic.
They are not, they're asymptomatic that,
Wow.
in the school system of the students. And then within, I'd say 3 to 5 days, if they're going to come down with it, they begin to show symptoms. And usually it's a sore throat, headache, runny nose.
I know in Leon County, they were saying they had at least 1 or 2 that had gotten very, very ill, like on ventilators, that kind of thing. Have we had any?
I
school
have
children
not
get
seen
ill?
any of that. That has not been reported, of school-age children experiencing severe illness with this. We've been very fortunate. Now, we've had some adults, and I think it's all touched all of our lives. One individual, you know, and every family member probably has been impacted by COVID from a serious illness. But that's the good thing about the monoclonal antibodies treatment that we have available. We have a state-run site there in Leon County. While the vaccine is your best protection against COVID, we do have this treatment that is available, that if you've been in contact with someone that has been positive, or you've had symptoms for less than 10 days, then you can, if the monoclonal treatment is taken early, it really reduces your risk of having a severe illness. So those are state-run sites.
The closest place to get that would be Leon County?
There's Leon, and then there are sites that I have heard of individuals obtaining that in Valdosta and Thomasville as well. But these are state-run sites, so that's the only ones that I'm reporting to you that I'm aware of. But I do know that there are individuals obtaining it in Georgia as well. We just don't get that data.
And you don't need a prescription anymore, right? You just need a positive
No.
test and they'll
Right,
give it to
right.
you.
Or you have been a close contact. I do know that we have a small supply at our hospital here. Our hospital is wonderful and have been great partners, and they have a very limited supply for their ER patients that are deemed eligible to receive this. So it is available locally if there are individuals in the emergency room, but that is administered, you know, at the discretion of the hospital. That's really all that I have. You know, I think the biggest issues that we've had to navigate is just the sheer volume, and then helping to educate the parents what appropriate test is acceptable for the types of symptoms that you have.
I recently saw a very informative YouTube presentation by Dr. Emmerich, the owner of Little Pines, and I would encourage everyone to watch it. I mean, he's a pediatrician locally practicing, and it was very informative for the general public, and just really informative. And I thank him for doing that, because sometimes, I mean, I think he brought it in perspective of what,
Yes.
in dealing with children, of what to look for. And
we've worked very closely with him as well to make sure that we're all on the same page, because they're seeing a lot of these families, as well as having contact with the school system and then also with the health department. So we work very closely with them actually in the Tri-County area. But Dr. Emmerich's presentation was very good, and his philosophy is pretty much in line with, you know, the school district's philosophy. He did make mention of those students who are asymptomatic that may try to test to come back to school early on day 5. However, saying that we're now going to identify more individuals, more students that have test positive for it, and they may test positive for 90 days after a previous illness.
right,
So they may not have been diagnosed with it, but 2.5 months ago, their entire family had it. So they're still testing positive, and then we'll have to quarantine them. And based on that comment, I did reach out to Dr. Emmerich, and he said that the first go-around when we were doing this last school year, there was a higher incidence of this happening. However, it's less than 10% in specifically in Madison County. So it'd be very few students that would test positive and haven't been diagnosed with COVID from a previous illness.
so basically that could be that a student would not be able to return until they got a negative test, and they may not get one for months.
Or they wait for the 7 or 10 days.
Right.
But, you know, yes, and that could happen. But he said it's less than 10% because they ask all the same questions we do. You know, when did your symptoms start? Or, you know, did anyone in your family have this? And when did their symptoms start? Or was anyone diagnosed? And at what period of time were they diagnosed?
That's a good question, though. On the asymptomatic ones, if on the 5th day I take a test and it comes back positive, at the 7 days, can I go back to school? Or now I've got a positive test and we got to start all over?
They have to wait. They have to wait their
10 days
7
from the
days.
date of the
Yes.
positive.
They have to
So
come
the-
back on their day 8 as long as they're not showing symptoms.
No, what I'm saying, once I have if on day 5 I have a positive test, does the 7 restart from that day 5?
The 10
Yes.
would start with
Yes, it will.
Okay.
Or if before that time they test negative, they can return because, you know, that's or. It's not and or, it's or.
One of the things I've heard that a lot of people are not testing positive to like day 8 or 9. And so if you come back on day 5 and you're negative, and then day 8,
We have seen some of that. We have seen some children that returned with a negative test, an appropriate negative test, and then 3 to 5 days later, they come up positive. It takes
Right.
anywhere from 2 to 14 days for your symptoms to show. However, in an effort to keep our children in school and these concessions were made, the new rule was made.
do you think, at what point do you think that it would be lessened with the quarantining? I mean, what will the numbers have to come down to? Because, I mean, as a board member, I mean, as long as this stays in, which I realize we're in what we're facing, but I mean, it's very hard to teach when you're having so many people out.
Right. Well, and I think that the bigger concern that you have is whether your teachers are out or not. We've been very fortunate that only 21 of your teachers have been positive, and there are options for those that are close contacts to be able to return early with reduced quarantine or designation as an essential
But
worker.
I mean with the
But with the
students, at what
students,
point?
yeah, there's not a magic figure. I think it's not that I think, I know. It's based on the circumstances of each school, each classroom.
So you're saying this could go on indefinite,
I have no end date.
right? Scary.
I mean, that's the $6 million.
Where the issue is, I mean, as a board member, the scary part is, of course, the children's health, but we have so many kids who are not on grade level. And for your students who are on grade level, missing 10 days is not going to be an issue. Students who can read, but based on our reading scores, we have a huge percentage who cannot read. Those students who are missing this time, I'm afraid that it's going to be so much, they're going to be so in the hole that we're never going to get them caught up.
I'm hopeful that at some point we will be able to treat this as other flus. However, with the intensity of the death rate that we have, I just do not know when that decision is going to be made.
I understand. I mean, it is what it is, but again, looking at what we're dealing with and students who are not on grade level,
Correct.
them being home multiple 10 days in a year, that is, I mean, these are students who need to be at the school every day the doors are open.
Well, and that's why if they're positive, now if
Right.
they're just a close contact, we do have other options. And that's why we worked with the schools to increase their mitigation, to prevent the number of quarantines.
It's just,
But you only have so much room.
right. Does any board member have any other questions?
No, I'd like to thank you for this information, though. It was very helpful.
Well,
Is
you're
there any
welcome.
way that we can get, like you gave the 156 positive, 21 positive staff, and the number of quarantine throughout? Because we have people asking for that, and
Hang on just.
we just want to be careful that we're giving out accurate information to where,
That information is provided daily to the school district, so,
Okay.
it's the determination of this board how you want to share that information.
Okay.
That's depersonalized.
Okay. Thank you for your presentation. Does anyone else have a question or comment?
I don't know if you can answer this. I'm going to go back to the 156 since August 6th. Is there any way to know how many positive cases we have right now?
Yes. I just don't have the information with
Oh,
me
okay.
right now.
Because it's less than this, I know that. That's not a huge number, but I mean, if you'd said 15 cases, I'd even feel better about it, you know?
Yeah.
so.
Well, we do have that information, but I just don't have it at my fingertips
Okay,
right now.
'cause
I was
I-
just giving aggregate information.
Yes,
You know,
okay.
since the beginning of time, I just assumed that would be what you were most interested in, but I apologize for not bringing
No,
that
you don't,
information.
there's no need to do that. I was just wondering. Oh, okay, thank you.
So I think it's much less than what you'll think.
I think if I was a parent, I'd feel good about knowing there's a low number, you know, we still will take our precautions, but, you know, in other words, it's not running rampant.
Well, it is running rampant, but not in the schools.
Well, I'm
There
talking
are a
about
lot
the
of
school.
quarantines
Right.
because that is a congregate setting. It's running rampant in the community. We're not seeing a lot of the positive cases coming from the schools.
Yeah, well, I'm just really was talking about the schools. And of course, the kids are in the community, I realize that.
I think what we have to be careful of, and Ms. Joseph and I have discussed this, is that we have to protect personal health information. We don't want to target a particular teacher. We don't want to know that a certain classroom has been, you know, totally isolated, because then you're going to identify the individuals in that, and it's going to be all over the community. You just have to be very cautious when you're presenting the data. And I would make it in aggregate form as much as possible.
Oh, yes.
But if we were to just say the number of cases within the district and not do specific
that's just
schools,
a
how would
general
you know?
statement.
I mean, we wouldn't be,
No, I mean, that's correct. You're
The
correct.
problem is, I think like she said, if you broke it down, for instance, if you said there are this many sixth graders at Lee that
No.
have that,
Right.
We
there's
wouldn't
only
do
one
that.
class,
do that.
so you could obviously,
Right.
you know, tell what class it is, that kind of thing. But yeah, I think you certainly know.
I've had parents ask concerning the data.
I've had people ask too.
And again, when they hear how many are quarantined versus how many have it, they do feel better about it. I mean, they do feel better. Like the day we had 100 and something quarantined at Central, and then you only say there's less than 5 who had it that day. I mean, statistically, that's a big difference than having 100 kids who have COVID. So I think that's what the parents are. I mean, it made this parent who called me feel better about it. So
Well, this is data that we're providing to the school district, and, you know, we've worked very hard to make sure that we've had accurate information, and, you know, I'm not going to publish that information. That is left up to the school district, how you handle that. I feel like I would be putting them in an unfair advantage and in a situation if I did do that. So this is their information.
As of the last report we received from the health department, which is a lag data, so day behind, we've got 45 students that's positive. Now, you gotta think of, we've got over 2,600 students in the district.
So that's a small percentage. then.
Yes,
So my,
yes.
I think if our people seen, you got 45, whatever, and that many, and they seen the percentage,
Right.
that would make them feel a little better, I think.
especially when you're,
okay, that's on our schools, and we've got about 2,100 kids in our schools. That's 45 out of 2,100. What percent?
What's the data I was going to look at?
2.14%.
Right.
About 2% of our kids.
I mean, when you
Oh,
look at
positive.
a timeframe of 2 weeks ago, you know, from August 27th to till today, August 27th till today, we've had 331 cases. And if you have just, you know, less than 10 kids in the school district that have, is very minimal. That right there tells you that it's not the schools that where these children are being exposed. It is at home. That's where the positive cases are coming from.
The night I spoke with a parent who called me about it, I mean, after I told her the information I had, she did feel better about it. I mean, and knowing that although that is a large number of kids to be quarantined, to only have so minimal amount who actually had
Correct.
COVID, I mean, it sheds new light on it.
The last report we did, not this past Friday, but the Friday before, in the last 2 weeks, we had 444 cases. So we try to push this information out. We are pushing it out 3 times a week from the health department. On Mondays and Wednesdays, we are pushing out case numbers to the community. And then on Fridays, we do a more extensive 2-page report, and it has more about vaccine rates and that kind of thing in there as well as how you can access testing and vaccines too. So we are putting that out 3 times a week.
Well, thank you for this information. That's enlightening. Thank you.
Thank
You're
you.
welcome. Anything I can
Thank-
do to be of help? All right.
Okay, thank you.
Thank you, Ms. Jensen.
Okay, at this time, 3.1, comments from the public. No public comment. Okay, we will move to the consent items. 4.1 would be the minutes from August the 16th, 2021 meeting. 4.2 is the amendment to the CenturyLink Lumen Internet contract. 4.3 is the Career Pathways Agreement with River Oak Technical College in Live Oak, Florida. 4.4 is the Dual Enrollment Agreement with River Oak in Live Oak, Florida. 4.5 is the Memorandum of Understanding with North Florida Child Development for the Madison and Greenville Center. That is from August the 1st, 2021 through July the 31st, 2022. 4.6 is the contract with Leon County, transfer of exceptional education students to the special day school, pre-K through 12, which is Gretchen Everhart. The alternative school, K through 12, which is Heritage Trails. The deaf and hard of hearing program 6 through 8 is Swift Creek Middle School, and the deaf of hard of hearing program 9 through 12 is at Lincoln. And 4.7, the fundraisers, MCHS Volleyball has a banner sponsorship, a new sponsor for $200 banner, a returning banner sponsor for $100. The cheerleaders are having a fundraiser for a 50-50 chance to win a raffle at all the home football games. And the volleyball team is also selling t-shirts, 8/27/21 through 9/13/21. And this is to go for paying referees and away travel. Is there a motion to approve the consent items?
I move to approve the consent agenda items.
It's been properly moved by Ms. Gibson. Is there a second?
I second it.
Second by Mr. Carroll. Is there any discussion?
Do we not have a hearing impaired, hard of hearing contract for elementary kids?
It wasn't listed in the what was in from Leon County, just those schools I mentioned.
If she did not present a contract for that, we probably do not have any kids need to be served from that population at this time.
Okay.
Any other questions? Okay, it's been properly moved by Ms. Gibson, seconded by Mr. Carroll. All those in favor, show a hand, please. 5-0, Ms. Bishop, for approval of the consent items. 5.1 is a presentation by Kelly Services. You may go to the podium. Thank you.
Good evening. I'm excited to be here in front of you tonight to explain the benefits that Kelly Education can provide to your district. I will go through the presentation. It's up there on the screen. You've also been provided with some materials that you can go through that way as well, and some pamphlets, as well as my contact information. So once we do conclude today, I invite you to reach out at any time. I am here to support you as you go through this decision-making process. Kelly Education. So we have 24 plus years working with different school districts, large and small, across the state of Florida and throughout the United States, in 42 different states that we're in now. Going on to the value. Basically, what we're here for is to create operational efficiencies and reduce administrative burden on the district. This in turn will allow your staff to focus on other items of interest and impact, such as student achievement, teacher vacancies, teacher retention, and so on and so forth. We also are looking to ensure quality through professional development, ongoing training, and coaching and recommendations through this partnership. Not only can we help out with substitute teachers, but we're able to help the district with any position that you would find within a school district, such as teacher placements, paraprofessionals, custodians, clericals, school nurses, and professional positions like IT and HR as well. I would like to explain to you the process and kind of start to finish what the program looks like. So feel free to interrupt at any time if there are any questions or comments as I go through this next slide. A high-level overview of what the partnership will entail is the obvious: recruiting. We are in COVID crisis, as we just heard a moment ago from the health department. There are lots of cases. Teachers can be out at a moment's notice. So we are working to increase your substitute pool, so that'll in turn increase your fill rates and bring that continuity to the classroom when the full-time educator is out. We go through a complete screening process, and then the hiring and onboarding, professional development, which is prior to being vetted to go into the school system, and also an ongoing initiative as well. And then we also have a technology platform called Frontline that we utilize for the scheduling and reporting piece, and retention and recognition initiatives to really hold on to that top quality talent that we see come through. Moving on to the next slide, recruiting. This is a hot topic. Right now, it is a pain point for many districts across the state of Florida and the Southeast. What we do is come in, when we partner with a district, we have lots of different avenues for increasing applicant flow. As you can see, many listed out here. A big favorite of mine is grassroots recruiting. So we are boots on the ground, coming into the community and placing lawn signs, flyers, attending events such as PTO, maybe football games, really immersing ourselves within the community so that we can see that applicant flow increase. Other areas that we will explore are the unemployment office, more obvious forms of recruiting such as platforms on Facebook, LinkedIn, ZipRecruiter, and so on and so forth. Once we have that applicant flow through the door, at that point, we're going to take them through a vetting process. Screening and hiring, we are going to do a pre-screen, make sure that they are, in fact, eligible for this particular role, a good fit, confirm work preferences, interest, availability, and certifications. If they seem to be a good fit, then we take them to the next step. That is going to be a behavioral-based interview process. It is a very rigorous process. We want to ensure top quality talent is coming to work in your school district. There are pass-fail assessments that they must pass prior to moving on to the next step. And then we will also check their references, education, and employment history. Once that step has been completed and they are determined to be a good fit, we move on to the hiring and registration process, completing those employment forms and the I-9 eligibility. Finally is the screening. We have a very rigorous screening process. We run our own criminal background check and national sex offender registry check. Once those items would come back clear, at that point we are going to mirror what the district does, which of course is facilitating the fingerprinting. So at that point, hiring is complete. A person is completely vetted to be a substitute. Next step is training. We are going to do a complete orientation, training and professional development. You can see there on the top portion of the slide, it's called Kelly ClassSmart. So it's, again, very rigorous. You have to go through each module, each topic, and then pass those assessments to move on and be qualified to be a substitute teacher. Another really neat initiative that we have started in recent years is a mentorship program. We have a team of retired individuals that have extensive backgrounds in teaching, some assistant principals, and many years of education experience. We take those individuals and have them mentor new substitute teachers. They will do sometimes on-the-job training where they're coming on site, monitoring them and giving feedback, coaching. We'll also have them reach out via telephone and act as a support system to them, which is really helpful for those new subs. Frontline education, scheduling and reporting. So Frontline, Kelly Education is Frontline's largest customer. It's an online platform that is used for absence management. It is available to the district through a partnership with Kelly at no additional cost. We assume all cost with Frontline. It's available 24 hours a day, 7 days a week. Anybody can go in that has access and permission to not only document and log in teacher absence, but also assigning activities. From that software, we can also pull many reports for the district, which we do on a regular, consistent basis. Absence trends, predictions. Maybe we're seeing, there's tons of teachers taking off on Fridays. So we need to kind of put something into place to bring and drive that down. So a lot of good data can be pulled from this online system, which we completely train the district users on how to do it. Very user-friendly system. We also have a client engagement team. So if you were to partner with Kelly Education, you will always be able to reach somebody. Starting at 5:30 in the morning, we have a team of client engagement folks, over 65 strong. We are increasing that number because of the high demand that we're seeing with COVID and absenteeism rates. They are monitoring absences constantly, especially those last minute call outs. And proactively making phone calls to substitutes to get those filled. They handle over 1.8 million requests for assistance each year. So that is available starting at 5:30 in the morning. So when we partner with the district, not only would you have a local contact, that you can reach out to, questions, assistance, and those types of things, you'll also have access to this team of individuals starting at 5:30 in the morning for those before school absences. As we all know, we get a lot of those, call outs, somebody's sick, their child's sick, and it creates a lot of stress on the district, on that particular school where you're trying to scramble around last minute and find that coverage. That's where we come in and we're able to work to get that filled for you and get a quality educator in that teacher's place. Next slide, retention and recognition. Half of the battle is really getting those folks through the door, getting them hired, trained, and ready to be a sub. The next half of the battle is retention. We all know that we're experiencing a lot of different struggles and challenges due to the pandemic. Prior to the pandemic, we had a national teacher shortage. Substitutes were at a shortage as well. Now, with the pandemic, that has been only such exasperated. So what we do is once we get that top talent through the door, they're hired, we focus on retaining those folks. How do we do that? So we're able to provide medical plans, prescription coverage, vision, dental, group term life insurance, short-term disability, and legal services. And they are eligible for those benefits on day one, regardless of how much they work or how frequent or infrequent they work. They have access to buy into that cafeteria style benefit plan. We also do offer them optional 401k, employee assistance program, and then weekly pay. So our subs are paid every Friday, which is very important. Most substitutes are used to being paid once or twice per month. Additionally, an annual service bonus is given out to our substitute teachers who are working a minimum hours requirement, and we have several employee discount programs. Recognition is huge as well. A teacher who is coming in as a substitute and is doing a good job wants to feel recognized, wants to feel important, and like they're a part of the district. So what we do to provide recognition for our subs is a Substitute Teacher of the Year awards. We also do a lot of kudos. So if you were to call me up and a certain substitute was doing a really good job, going above and beyond, everybody loved them, we might give them an additional kudos. Let's say they like Dunkin' Donuts, a gift card as an incentive for doing such a good job. So retention and recognition is a huge part of our program. What's this going to cost, right? The question of the day. So we do offer all-inclusive pricing. So what that means to you is everything that I've gone through, and I realize I'm throwing a lot of information at you in a short amount of time. This slide kind of goes over some of those items, the recruiting support, the interview process. You are receiving the background checks, fingerprint facilitation, and so on and so forth. Additionally, we are the employer of record. So we are assuming liability, workers' comp, unemployment, all of those normal employer type of related costs and taxes. So with that being said, I will go into the next slide, and that is going to be a cost comparison. Now, I will tell you the data that I pulled this from. I had to use it from school year 18-19, and that is because we have had so many changes over the past year and a half. I wanted it to make sense and use an example that would be would not have data that's skewed. So if you look at this, it's showing over on the left-hand side the number of teachers, your school locations, of course 180 days in a school year. The average absence rate, normally pre-pandemic, the national absenteeism rate is 8%. We all know that that's probably not the case in today's environment due to the pandemic. But I use that for the sake of this example so you could kind of see what the bottom line would be. Again, taking the fill rate on the left-hand side, a district managed 65% fill rate. We're filling approximately 8 subs per day in this example. Coming down to the bottom left-hand corner, we have we want to increase your fill rate. Our goal is 90% or better to have those classrooms covered. So we're looking to increase that. So on the right here, in the middle column there, you'll see the top, and it says financial impact summary, same fill rate. So that's saying if we leave it the same, apples to apples, a 65% fill rate from the district versus a 65% fill rate from Kelly Services, you are going to actually have a variance of a cost savings of $6,395. Well, we certainly don't want to leave it at a 65% fill rate. We are here in front of you, or I am here in front of you today to explain how we can increase that and still remain financially responsible to the district. So coming down to the bottom, in this particular example, of course, these are estimates. Currently, pre-pandemic, I was provided with substitute teachers costing somewhere around $164,503. If Kelly comes in, increases that fill rate with mirroring your pay rates district-wide, we can say it will cost somewhere around $218,000 or $218,919. So the variance there is $54,416 per year. So that's just kind of a cost comparison. Of course, it is an example just to kind of get you thinking about where you were and where you would be, you know, if we go ahead with a partnership. Going on to the next slide, let's just say over time, the goal is to reduce your absenteeism rate. We want your educators that are full-time in their classrooms as much as possible. It benefits the kids and it financially impacts positively the district. So in this example, I just wanted to show you what moving the absenteeism rate from 8 to 7% would do. That 1% on the left-hand side on the fourth column down, reducing that to 7 from 8% reduces the overall cost of the program. In this scenario, district at 65% fill rate versus Kelly managed at a 90% fill rate, bringing that overall cost down to $36,172 per year. So as we would partner, the goal would be to look at the data, look at the trends, and put different suggestions, recommendations in place to reduce your absenteeism rate over time. Next slide, frequently asked questions. So I just put some information here that I thought may be useful as you're looking at this and going through your decision-making process. It's a big decision for your schools, for your students, for your faculty and your staff. So first and foremost, again, we're the employer of record. They are still these substitutes are still very much a part of the district. You're in complete control. Principals and the district are in charge of who works in your building. If for some reason there was somebody in your building that wasn't working out and you don't want them there for whatever reason, the principal has complete right to walk them out the door and call us later. So there is complete control and you're not giving that up. Substitute preference lists are able to be put in place with that Frontline, the absence management software that we use. You are able to make substitute preference lists. So if the district just loves, there's 10 or 15 subs and they just work really well, teachers love them, students love them, so on and so forth, we can actually have all absences go to those folks first. And then if for some reason they're not available, open it up to the general pool. So there is some customization. Every district is different. So if we partner together, we will ask a lot of questions, peel away the layers of the onion, so to speak, to really learn what's important and implement that in your program. It's not a cookie cutter program. It is unique to your district. Your district is unique and different from your neighboring districts. With that said, at the bottom, you will see just an example. It's not an all-inclusive list, but just an example of some of the districts that we have programs with in the state of Florida. I'm sure you're probably aware that we partner with your neighboring district, Suwannee. We also work with Alachua, Hernando, Hillsborough, and Orange County, just to name a few. With that being said, with your neighboring district, Suwannee, we already have 16 subs that are active subs that are in Madison County that we could dip into and potentially utilize. In addition, we have 165 active subs in your neighboring county. We can utilize that as leverage to ramp up recruiting quickly should we partner. As a former recruiter, I can tell you that my first inclination would be, upon partnering, would be to dip into those 16 folks that we already have, and then also to utilize friend and family referrals from our neighboring district so that we can start generating some of that applicant flow and getting those subs in and qualified to work. Additionally, we do assume that the absence management software cost, you would never see any costs outside of when somebody works in your district. So basically, in regards to that, when somebody would work in your district, you would not be charged anything outside of that. So there would be, no background checks, there's no cost to start up, anything of that nature. And then another point I would like to make is we do have a non-binding evergreen contract with a 30-day out clause. We want to be a good partner. We are here to support you. We are here to bring continuity to the classroom, and which overall impacts positively student achievement. So with that being said, my recruiting and operations team is on standby. They are prepared to partner with your district, and again, with the goal of bringing that continuity to the classroom and reducing your overall administrative burden. I will open it up to questions, and beyond that, feel free, if there's something you think of after tonight's meeting or you don't want to talk about in front of the group, feel free to reach out to me at any time. I'm here to support you while you go through this decision-making process. Yes.
So in practice, the way it would operate is if a teacher called out sick, we would then call someone with Kelly. They would then arrange for a substitute and have that substitute sent. Then what do we do at the end of the month? We settle up and pay you for whatever substitutes you sent? How does that work?
I'll just give you an example. Let's say I'm a substitute and I come into your building. I was in there today subbing. I have a deadline by Sunday night at midnight to go into the frontline platform, enter in my hours. Every Monday, whoever we assign at the district would receive an email. That email would say, Jessica Johnson said she subbed on such and such date. And then you approve or deny it depending on, what that looks like. I'm paid out that following Friday for my day worked. And then that next week, you would see an invoice consolidated on whoever worked in the building. And then the terms are 30 days.
And is it the same charge for all different grade levels and all of that? So a sub in second grade classroom is the same as a sub for a high school math class?
The training may vary, but the rate is the same. So we will customize the training, especially if we have special education teachers as well. We have a whole separate module for those individuals. But regardless if they are a kindergarten teacher or a 12th grade teacher, it's all the same. Just the training may vary a little bit per position. And that's what we do on our end. We also do pay our employees for training. It comes out of our budget. There's no invoicing to the district for that.
Mr. Chair, we are looking at this for substitutes. We're not displacing any workers because substitutes are contract labor for us. But we're also looking at substitute for classroom work as well as substitutes for lunchroom workers, as well as substitutes for custodians, because at this point, we have openings for custodians that we cannot hire. We have tried to hire custodians, we can't hire any custodians, no one's applying, and we're looking for lunchroom workers to hire. And our substitute pool is basically almost dwindled. I think we've got about 5 active substitutes in the entire county. And at any given day, Central has 6 to 8 teachers out. And if we're concerned about the education of our kids, what's going on, we'll pull in one teacher from one place, or a para from another place, from serving students just to babysit or manage another class. And so that's what we're looking for, someone to come in to substitute, so we won't have to shortchange a student by pulling their resources and put them in to work with another kid. And this is not displacing any workers. We're not trying to outsource anything.
For the hourly rate, so that would stay the same?
Yes, so we mirror what the district does. We
Okay.
pay exactly what you pay. If, as we look at recruiting, and we'll start kind of, like I said, my analogy, peeling back the onion, right? And the layers of the onion, and getting down to, challenges, we may make recommendations, but you are in the driver's seat as far as the pay rates go, and we mirror what the district has in place for the pay rates.
So is the rate you charge, like 120% of that hourly rate, or is it some formula like that, or what?
So what goes into it's, you've got your pay rate, your established pay rate, and then we have a percentage markup on top of that equals your final invoicing rate. What goes into that is everything we're absorbing. So we want to make sure that we are having enough resource to get a good, solid recruiting team together to do the recruiting activities, canvass the area, grassroots, those types of things. We're also absorbing all of normal employer taxes, the frontline technology, and so on and so forth. So with that, the price that I was able to, or the percentage rather, that I was able to secure within my financial team was a 36%.
3.6?
3.6, yes. Mm-hmm. Yep.
So you're saying that you can give us data over the school sites of like how many people we have out? Because I think that would be really informative for the board to know, like, on this month, we've had this percentage of absenteeism in the school
Yes.
from staff.
And we're able to pull some of those analytics and do some predictions as well. So what we've done with other districts, and again, it varies district to district, but what we've done to kind of mitigate some of the absenteeism rates and unfilled classrooms is if we see this data and we see that certain school has at least 1 or 2 absences every day, we can set you up with a building sub where one person reports daily and goes wherever they're needed for that particular day. There's lots of different ideas that we can come up with to really reduce having those unfilled classrooms and reducing teachers, maybe assistant principals or parapros having to cover these classrooms. Instead, we can look at different options like a building sub if that's something you would want to explore. There are lots of different solutions that we can come up with when we pull those analytics and really observe the challenges present.
I think at some point, we probably need to ask the hard question of why people are out.
I'm sorry?
We may need to ask why people are out, why we're having such a big absenteeism on certain days, whether it's Friday or Monday, and people just not coming, because in the school year of 18-19, I mean, we had an enormous amount of money that we paid out for subs. Mm-hmm. So, I mean, it had to be a lot more out than 8 or 9 a day for this amount. I mean, this is a lot of money we've paid out in the past. I think it's something we should look into. It is somewhat reminded me of years ago, Ms. Williamson may remember the energy conservation program where you have someone who's like trying to like look at it of how you can, we did an energy conservation of how we could save money for the district. And if this can save us money, then I'm all for it. I know it's hard to find subs, and not right now we're having to rob Peter to pay Paul, so to speak. You're pulling people from every available, you're pulling people who are hired possibly to be aides in classrooms out of the classroom, so the teachers aren't able to do small group instruction because she doesn't have anyone in there to help her, and this is a trickle effect of what we're having.
I had the same question that you did about the pay rate, because in my mind, that's an incentive to take it, to substitute
Well,
the pay. And
Well-
we only have, what, you said 5 subs right now?
For the entire
Which is
county.
for the entire county, but I'm wondering, why would they want to do it? How do we get more paying in the same price?
Okay, with Kelly, and I'm not asking you to vote on this tonight, because this is something that I hope if we enter into it, that we have a successful relationship, and so we need to make sure we do our homework. One reason is that they become employees of Kelly Services, therefore, that helps our county, and that helps the employment rate. And so here, you contract labor for us, what you get on your paycheck, that's it. You do not have a chance to even buy into our insurance program. Their employees will
that's-
have an opportunity to buy into their
That's a
insurance
good, that's an
program.
incentive right
they
there.
would have
Yeah.
benefits.
They will
insurance,
have benefits
401k.
because they
Yeah.
are a full-time employee with
Yeah, I can
Kelly.
understand that.
And let me clarify this, would, the employee would contact Kelly if they're gonna be out, not someone at the school, and then Kelly would find the sub?
So we can set it up a couple of different ways, and districts do it, everybody kind of does it different. So one way that we can do it is having the teachers to have access to the system, where if they're out, let's say it's 5:30 in the morning or the night before, they have a sick kid, and they go into the system, it'll say Jessica Johnson, 2nd grade teacher, my reason out, I'm sick, do I need a sub? It's a yes or no question, you save it, all the subs in the pool will have access to pick that particular assignment up. So some districts choose to do it that way, where the teachers go in and enter in their own absences to reduce administrative burden, a secretary or somebody at the school doing it. Another way some smaller districts will do is say, nope, I don't want teachers having access to that, and they will assign a few people at each school to have the teacher call in sick or call out to a particular person, and that person will go in and log the absence, which takes seconds. It's very, very user-friendly system, and we would teach the district and whoever would need access how to utilize it.
That's probably not so bad if you have a school where people aren't really out, but
Yeah.
at some of our schools, if you have a large number of people out, that's a bad job for the person getting all those calls at 5 o'clock in the morning.
Yes.
I mean, in reality, and at our bigger school, you could have, I'm sure it's more than a handful out.
But they're doing that now, they're calling the person at
Right.
the school site now.
So you're saying choose the Kelly, have them call Kelly.
Right, that's a lot of extra burden on someone beyond their workday, having someone call you at 5 o'clock in the morning.
And if they're the ones finding the subs,
Right.
give them the information as quick as you can,
Right,
and then they.
right.
Right, and you're able to, the administrators will have access 24/7, so you can always go in and see which teachers are absent and who's filling that particular teacher absence. So you'd always be able to have visibility and transparency there.
Do y'all have any type of ideas on incentives to have people come to work?
We've done numerous different initiatives. We'll do referral bonuses. Those seem to be big. Like I said, my first thought would be for us to use as leverage the subs that we already have so close to us with your neighboring school district. And incentifying with referral bonuses. So we will do referral bonuses, and that usually does help drive in some of that traffic. You know, I can imagine sitting in your seat that you're probably thinking, we're struggling, how are you gonna do it, right? That's what I would think if I were sitting there. So I will just kind of answer that without being asked. We recruit all day, every day. We have thousands of recruiters that work within our organization that can really devote that time and attention to recruiting, onboarding, training, hiring, all those activities. So it's taking that just off of the district. We do it in such volume and bulk that we're able to have a, you know, kind of that bigger reach in the community. So like I said, I can imagine that might be a question, and there's not a magic switch. There really isn't. We're in a pandemic. We're in a tough environment. I will tell you, and I keep referring to your neighboring county because it's so close, you know, in nature, right? We're not far away from them. They are at a 91% bill rate as we speak. So it can be done. We will put all of our efforts into a partnership and ensuring that we are meeting that high, those high numbers for you.
And
You
Mr.
had a-
Alford, another thing, by going with someone like this, not necessarily, that will also increase our attendance rate of our staff, because our staff, sometimes they stay home to keep from having to sub for someone else. Because they know if they have a high absentee rate, somebody's
take
gonna
the day
get
off.
pulled from their class. And so rather than me being pulled to sub for someone, I'll stay home that day. And if they know they're not gonna be pulled, they will come, a lot more will come to, work.
I know in the presentation you had said concerning like with recruiting of teachers. I mean, we have trouble finding teachers also. Is there a charge for that, or how would that?
There is. My recommendation would be to do attempt to hire type of situation. So we would get a sub in on a long-term assignment. They would report every day, be involved in lesson planning. And if you like them and they worked out well and you wanted to bring them on as a full-time teacher with a vacancy that exists, you would be able to do that. There is a small conversion fee. We can talk about that, you know, outside of this meeting. However, you're able to take our employee and hire them on for a full-time vacancy. That is certainly, a lot of districts do that. As we build our pool, I would keep that in mind for any vacancies that arise or that you have at the time, you know, because it's going to help with those vacancies, and you're able to kind of see how somebody performs before offering them full-time employment, which of course is taxing, you know, with benefits and all of those types of things. So you're able to ensure that somebody is a good fit before extending that offer of employment.
Do you get certified teachers?
Yep.
In your substitute pool?
Yep. So we mirror what the district does. So, you know, if you want, just for your basic sub, a high school diploma, we'll do that as well. We also find folks that have the associate's and bachelor's degree as well as certified teachers. So, you know, it just varies. You know, the pool definitely will have a mixture, but we do follow what the district, the district guidelines are for education requirements.
Does anyone else have any questions for?
Well, you know, where I was working, we had that. It wasn't Kelly Services, but it was ESS, but it was, they done what she's talking about with our subs, and that frontline absentee management thing is so simple. It really is, and you can do it on your phone. You know, so I mean, a person can do it on their phone, and then you know who's out, when they're out, and all that kind of stuff. But it was really good. The two things that people signed up to do it for up there was they got paid every week, and the benefits, they was offered some benefits, so that helped
That's an incentive.
recruit people.
So you liked it at where you were at?
Oh, I did,
Yeah.
yeah.
I've experienced Catholic services also,
Okay,
so it was a very good program to get involved in.
well, perfect.
The
Thank you for that
once a week
feedback.
payment is nice. Years
Yes.
ago, I worked for a company that paid once a week, and it was nice.
Every Friday.
You get a check every Friday in your account.
Right.
Are there any other questions? If there's no other, we do thank you for coming tonight.
It was a pleasure.
This is a issue that we have that hopefully this can help us alleviate this problem.
Yes.
And it is a problem that has grown a lot from the pandemic, and we had the problem beforehand, but this is somewhat just made
Exasperated.
it's made it a lot worse.
Yes. Well, I invite all of you, reach out, email, phone with any questions if you think of anything between now and next board meeting. Perfect. Thank you.
And-
Yes.
Mr. Reeves had a question. Should we ask for a proposed contract that we could look at and then? Okay. I think Ms. Joseph has it.
Okay.
Well, thank you, and we
Yes,
will
thank
be
you.
getting back with you concerning
Perfect.
this. Thank you for the presentation.
Thank you.
Thank you very much, and I will be in touch with you.
Thank you, Superintendent.
Okay, that was a presentation by Kelly Services for information only. 5.2, personnel changes, Mr. Killingsworth.
Good evening.
Good evening.
This one's gonna be short and sweet. At this time, we have one recommendation for administration, one for the instructional, 3 for non-instructional, and then we have 3 at the bottom that are leave of absence, Medical Leave Act. As of right now, one of those, I will let you know, I will bring back to you next board meeting when I get the official paper that's probably going to go into the resignation of those 3. And then, of course, you have one that's for a supplement that's on the back. But that's all that we have at this time. I should have a couple of more, probably 3 or 4 for your next board meeting.
Okay, is there a motion to approve the personnel changes?
I'll make a motion to approve personnel changes.
It's been properly moved by Ms. Williamson. Is there a second?
Second.
Seconded by Ms. Gibson. Any discussion? There's no discussion. All those in favor, show of hand, please. 5-0, Ms. Bishop, for approval.
Thank you.
Thank you. Item 5.3, Joanne Bridges School Improvement Plan. Ms. Thomas?
Good evening, everyone.
Good evening.
I am here before you to present Joanne Bridges, which is our DJJ school in Madison County School District, their school improvement plan. I was able to meet with them several times over the past month to help develop it. Just some highlights, and I think you guys have the electronic version of the plan, but just some highlights of the issues they had, and then their plan for trying to improve those issues. Through their testing, which is their assessment they have for students to take when they enter and exit the program, their language arts was definitely an issue. They noted most students were 2 grade levels or below for reading. And actually in math too, they were 3.6 grade levels behind when they entered the facility. Only 5% of the students showed gains from their first diagnostic when they first entered, in comparison to the exit, which was their second diagnostic. So that's That's not good. They had several areas in which the state said they needed to make sure they improve this year and come up with a plan to work on those things. One of the areas was their ELA, their reading learning gains, and once again, that is it's driven by their pre and their post tests when they come in and when they leave out. One of the biggest issues they had is that many of the students did not take the exit test, so there was no data to compare to the pre-test. 35% of the students who were served, and this is for the 18-19 school year, failed to complete the exit test. So we're not sure what they would have scored. So that's definitely an issue. Of those who actually took the test, 50% of them made learning gains. So, of course, after talking with them and sitting down, it seems as though if more students had taken it, they would have, done better in this area. But once again, the state did say that this was an area in which they needed to work on and make improvements. So they have a few goals in place for this area of improvement for their ELA learning gains for reading. And one of the things they want to do is to make sure that they're utilizing a data tracking sheet. I work with them to develop a progress, well, not a progress monitoring, but a monitoring tool to where when a student arrives at their facility, they'll have the date, and then they also have to put in the date which they take the test, the date that they take the exit test, just so that it can help them with tracking and making sure that students are actually taking the test when they exit. One of the other things they're going to do is provide some incentives as far as motivation for the students to do well on the test. They felt like they would have had more students, the 50% who did make learning gains in reading, they felt like that number would have increased if they had more incentives in place. So they are working on different type of incentives for the students. And then also they are trying to actively recruit, and this will go into their next area of focus, but trying to recruit ELA content certified teachers that are able to meet with them on a face-to-face basis. While most of the students use the program to do their classwork, they still have access to a face-to-face teacher, but they would like them to have more access, and also the teacher would be doing data chats with them, just trying to make sure the students know where they are, why it's important to try to set goals, and then also help them track their progress and goals. So they were thinking that those things would help improve that area. Another area that the state said they needed to make improvements on is their attendance. The attendance is a little bit tricky for our DJJ facilities because it's not traditional attendance as we would think about it. Their attendance is what happens to students once they leave the facility. So after they exit Joanne Bridges and they go back to their respective districts, wherever they go to school, that school will then start sending in the attendance data for the students. And then if they find out, hey, this student just got released from Joanne Bridges, but they're not attending school, that actually reflects back on Joanne Bridges, which, in a sense seems unfair. But when you think about it, and as I spoke with them and we kind of hashed it out, we talked about the importance of making sure you create internal motivation for the students to understand why school is important. So that's the route they're going to take. They're going to use their trauma, I think they're called their trauma program staff, to help build in incentives for school importance, school attendance importance, and also just to be talking with them, helping them create career plans, and just sharing with them data about school attendance and how vital it is, and how, the alarming statistics, how if you're in ninth grade and you miss a day out of those first 30 days of school, it decreases your chance in graduation. So just shedding light on a lot of stuff that students may not know about attendance. That's going to be one of the things they do. They're also going to use one of their staff to try and communicate with the students once they leave the facility. So they'll be getting their, the parents' phone number, the address where they're going to, and that person is going to be following up, just trying to encourage them, keep that relationship going, saying, hey, I hope you're in school. Are you doing well? Talk to me about what's going on. And that's how they're going to approach that. And their last area was recruiting qualified teachers. And that was their last area the state said they need to work on. They are having certain goals that they're going to meet. They're going to attend teacher recruitment fairs. Hopefully they were watching the school improvement meeting tonight, school board meeting tonight, and they saw that Kelly Services, right, might be one of those recruitment fairs. But also they said they're going to utilize social media, of course, just like everyone else, and try to get the word out that they are trying to recruit teachers. They do not have subject area teachers for the other subjects. And so that is the reason the state identified this as an area of need. And that is what they're working on, trying to find math teachers, trying to find science teachers, trying to find history teachers. The other thing they said they're going to do is establish interviews based on the applicants meeting the minimum qualifications. So they're going to make sure that they're not just, accepting anybody, but that they go through some type of, rigorous process, and they make sure that they're actually certified in those areas. But just like everyone else, they're having issues as far as finding, assistance. So that is what they're going to do, and they are going to work with our school district to see what type of ideas we have in order to share with them too.
Thank you for helping them and trying to help them get this all straight. Are there any questions?
I was just wondering if you knew how long of a stay, what's the average stay for students at that facility?
And I asked her that too, and she said most of them are there for at least, 7 to 8 months, so almost a whole school year or longer. Right now they have 13 students. She said their their maximum they're allowed to have is 28. So they still have availability. Right now they have 13 enrolled.
Now, what was this 34? I thought I saw somewhere along the line it said 30. They don't have 34 students. I saw 13.
No, ma'am. That's probably, you may be looking at their early warning systems data. One of the things the state is requiring DJJ facilities and school districts with regular public schools to do is update their early warning data, and that is from the last couple of years.
Yeah, early warning.
So it may be, in the year before that would have been the 18-19 where they had 34 students, but right now they have 13.
Okay.
And so they had probably, that's what it was. They had 34 then. And as you know, it's a facility, it's all girls, and they're ages 12 through 18.
Okay, is there a motion to approve Joanne Bridges School Improvement Plan?
I move to approve the Joanne Bridges plan.
Okay, it's been properly moved by Ms. Gibson. Is there a second? Second by Ms. Bell. Any discussion? Okay, if there's no discussion, all those in favor, show a hand. 5-0, Ms. Bishop, for approval. Thank you, Ms. Thomas, for your work on that. Okay, 5.4, staff trips. Ms. Joseph is to Orlando 9/21 through 9/24. Mr. Goyette is to Orlando 9/20 through 9/21. And I'm to Orlando from 9/23 through 9/24. Mine's not on there,
You were approved last time.
I was?
Yes, you were approved last meeting.
I didn't realize that. Sorry. So those are the staff trips within the next few weeks. Is there a motion to approve?
I make a motion to approve the staff trip request.
Second.
Okay, it's been properly moved by Ms. Bell, seconded by Ms. Williamson. Any discussion? All those in favor, show a hand, please. 5-0, Ms. Bishop, for approval. Okay, 5.5, Value Adjustment Board. I had I have contacted a business owner who has agreed to serve on the Value Adjustment Board for representing the school board. We needed someone, didn't we?
Yes.
It's Margaret Ann Smith with Smith Abstract and Title. Ms. Bishop,
You need a motion second.
okay, is there a motion to approve Ms. Smith of Smith Abstract Title to serve on the Value Adjustment Board?
I'll make the motion to approve Ms. Smith to serve on the Value Adjustment Board.
Okay, it's been properly moved by Ms. Williamson. Is there a second? Second by Ms. Gibson. Is there any discussion? If there's no discussion, all those in favor, show a hand, please. 5-0, Ms. Bishop, for approval for the Value Adjustment Board representative.
And we also need a school board member to do that.
Okay,
I
who's gonna be the
think
lucky?
I think that was me.
I think,
Okay.
Yes.
We've done that earlier. We just
I just
didn't
don't
have-
know, I mean, I hadn't heard anything. from
They'll,
anybody.
last time, there weren't any appeals.
Right.
That's coming up, so unless it's settled, maybe they all will be settled and you won't have to go this time. But they'll let you know the
Yeah,
closer
Mr.
it
They
gets.
Washington.
file a lot and then
Mr. Billy Washington will.
Oh, okay.
yeah. They file a lot and then they try to work them out, so hopefully they'll, so
I got you.
you don't ever know.
It all was settled last year, so maybe this year will be another year like last. Okay, 5.6 supplements, Ms. Joseph.
Okay, the supplements are as presented. We've got the academic supplement list from the central school, and we have some more additions to the supplement list from the high school.
I just
And
have a,
these fees they are scheduled through the union. It's not something that we do.
I have a question. For these like team leaders, do teachers apply for those or are they chosen by like the higher beings?
I was one, but I don't remember how it all
I was
played
just
out.
curious.
I think they just, I think they asked you to do it. Excuse me. Just. Did you say it went through the union, Ms. Joseph?
No. I say these positions and these fees are set by the union.
Fees are set by the
It goes through
union.
the schools, like through the higher beings.
Right. Okay, is there a motion to approve the supplements?
I made the motion to approve that.
It's been properly moved by Ms. Bell. Is there a second?
Second.
Second by Ms. Gibson. Any discussion? Okay, if there's no discussion, all those in favor of the supplements presented, show a hand, please. 5-0, Ms. Bishop, for approval of the supplements. 6.1, superintendent items.
Okay, Mr. Chair, one thing that you had at your placement of C is that I teach school to submit their COVID plan for their schools. And so I know a lot of people ask you something, what is this school doing, what is this school doing? And so each school have submitted their COVID plan for, as of right now. It might change, but this is what they're doing for right now. I did not ask the principals to come because a lot of it's basically something that they've done last year. But if you would need additional information, let me know and I'll get them to come and answer.
I mean, I think this is sufficient, what they've provided. I mean, if a parent were to call us, we could at least have an intellectual conversation with them of what's
And you got
happening.
something else?
Right. We could have a conversation.
That's all I have for tonight.
Okay, Mr. Attorney, any items?
Well, I'm sorry, I have one other thing. I'm sorry. As we're growing and we're progressing, we're trying to get more technology savvy. And Ms. Rayneck is working on getting e-card with us. You want to explain the type of card that we're pursuing and we'll bring it to them?
Yeah, we're looking at, going to to a purchasing card. We're talking with Regions Bank about the purchasing card. They would like to come do a presentation. But basically, it would be a couple of people at the district would control the limits that are on it, and they would be able to give it to travelers to use, to take with them. But the limits would be set on it, so they couldn't spend it for just anything. They would only be able to spend so much based on the trip they're going to, where they're going to. And then when they come back, the cards would be returned and the limits would be eliminated. So it would be constantly working with them to make sure that they had access to electronic billing while they were out traveling, and then return it to us when we came back. It's an upgrade pretty much from the credit card, from the district credit card. The district credit card is requiring us to use personal social security numbers, and we're trying to get away from that. We have a tax ID number in the district. We want to use the tax ID in the district. They will give you a presentation about it. I'm not sure when they're talking about it, but sometime soon. There will be the opportunity to also take limits as high as, as we want, but use it for other things like paying for utilities and then getting rebates from the cost that we're expending on the cards. So we haven't got all the details yet, and they're gonna, Joseph's gonna plan for them to come and do a presentation and let you know in more detail, but I think it's progress from where we are right now. We will eliminate some of the manual check writing that we have to do. So
And one of the biggest difference from what you're saying is setting a cap on the card. If you were to send a card with someone,
exactly.
it would be a cap on it and not an endless card.
It's
Not that anybody would do
It's an
that.
upgrade on the credit card, and it's a more secure than a credit card because you can specify how the credit card can be used as opposed to just give me a standard credit card. When I go buy gas, I can also go in the store and use that credit card. But with this, we can limit that. You can buy gas with it, but at the gas pump, but you can't go in the store and it says, I need me a bag of chips also. So you can't put limitations on what it can be used for in real time.
Right now, when people are traveling, like to buy gas, they're given 3 or 4 credit cards for different types of gas stations. They have to start looking for a gas station.
You also run the risk of losing all those credit cards, and then it's a major ordeal for the district, for somebody.
But this way, you can cut it off immediately.
Right.
But it's more accountability.
That sounds good. That sounds good. Ms. Joseph, is there any other?
That's it, thank you.
Okay, Mr. Reeves.
I just have one thing. We've just completed the census. It will be 10 years. We are in the process, or will need to begin the process of redistricting. The county, the school board, and the city of Madison went through several federal lawsuits back in the 80s on redistricting, and we basically had the same districts since then. We'll need to go back, though. I think now we're far enough away from that, we're going to need to go ahead and start that process again. Now, I don't know if you're familiar with that, but if you look at our county, at a map of your school board districts, the county commission districts are the exact same as the school board districts. So in other words, District 1 for the school board is the same as District 1 for the Board of County Commissioners. And then the way we do that is in every even numbered year, all 5 districts are at play. So you've got the odd school board districts one time, and then the even school board districts the other time, and then the county commission's reverse, right? So the reason it worked out that way was because it's cheaper for the county and the school board to come together, hire one consultant that goes in, because that consultant's got to look at how to divide the county up into to make sure that everything's equal and all of that. And that takes some specialized knowledge. That's not something a bunch of us could get together as a committee and say, okay, we're going to run it this way or that way. And so that's why that happened that way. It's not that way in huge big deal counties. They'll have county commission districts and school board districts will be different, or can be different if they want to. Also, it is my understanding they did back in the 80s, of course I wasn't around then, was the city of Madison was also part of that, had the same consultant, and because the city of Madison's city commission districts are divided into single-member districts. Now, it is my understanding, I know for the town of Lee, they don't have districts. They run citywide, so they don't have to redistrict or anything. I believe the town of Greenville is the same way. They run citywide over there, so they wouldn't be involved. So anyway, we're going to need to start that process. And so what I'm wanting to do now is just kind of tell y'all, hey, we need to start the process. What I'm going to try to put together, and I'm going to talk to the county tomorrow and probably the city at their next meeting, and try to kind of put together a timeline and, hey, this is what we need to do and when we need to do it. And then we need to start looking for a consultant that can help us do this. And obviously, it's going to be much cheaper if the city, the school board, and the county can all team up and share the cost of that one consultant. And so that's what I would like to kind of propose. Last time we did it, we all did it that way, but I know that's way before any of us were involved in local government. So I'm going to start working in that direction if that's okay with y'all. And I just want to know, make sure that y'all are on board with that. And of course, if we find a consultant, we of course would have to bring that person back. They'd make a presentation to y'all. Y'all would have to approve and all of that. But it's something we're going to need to do and kind of get started on.
Would this be for the next election or?
I'm not 100% sure. I think it is. I don't think it's going to apply to the 2022 elections because we're already in September of 2021, and then your qualifying and all that comes up in the first part of 2022. I don't think you have time to do all of that by 2022, but I don't know that. I've never done this before. This will be the first time I'm involved in it. But I think we need to, we just need to get started. And that's what I wanted to kind of bring up so it's on y'all's radar.
Okay.
And I don't know that, Madison has had the same population hovering right about 20,000 people for 50 years at this point. I don't know that there's going to be a lot of changes countywide. I am told anecdotally from people, especially the last supervisor election, said that from his records, he saw the population had shifted because there seemed to be a lot more people moving in to the eastern side than the western side of the county. And so that may change the district lines. In other words, that district may shrink a little bit and other districts may increase a little bit, that kind of thing.
Okay.
That's all I have, Mr. Chairman.
Thank you. Mr. Carroll?
I don't have anything. I want to thank the lady was from the health department. That was really good information there. And I do think that if we could get out to our people, some kind of, that we got 2,500 kids and 45 is positive, that's only 2 point, the percentage. Same with the employees, you got 500 employees, 21 out of 500. It just shows that for our folks that, it's bad, but it's not that bad. The school system I'm talking about. So anyway, that's all I have.
Ms. Bell?
I want to thank Kelly Service for their presentation, and hopefully I look forward to working with you. I want to also say that I pray that COVID go away. I want to also say that I know that it's important that our students stay in school, but for the safety and the well-being of our staff and students, that was come first in my mindset. And I think that I want to thank the health department for coming out and giving us the information that they provided. And we need to definitely follow the guidelines provided to us for quarantine. Thank you.
Ms. Gibson?
And I want to thank Ms. Johnson for your presentation, very interesting. And I also appreciate Ms. Albritton. And like Mr. Carroll said, I think as a parent, I would like to know as much information as I could know about what's going on in the school system. And we know it's a serious situation, but it seems like the schools are progressing without too much too many problems, which I'm thankful for.
Ms. Williamson?
And Kelly Services sounds very promising, and I appreciate the help, Ms. Albritton and the Health Department clearing up some things for people, because you hear so much out there and the parents get confused and stuff. So, it's good that she comes and does that, so everybody's everywhere on the same page.
Okay, and I too would like to thank Ms. Johnson for coming up tonight, traveling and with Kelly Services to make her presentation. I would like to thank Ms. Albritton for her information and what she provided. I too feel like that the parents need some sort of data where they can look at to see constantly the number of kids who are maybe quarantined and have it as close as we can have. I know it's a move-in target and there always could be discrepancies, but it would make them feel a little bit better. I would like to encourage all to watch Dr. Emmerich's YouTube questioning that he went through concerning COVID, and that's real informative. And also, Ms. Joseph, from the email you sent out a few days ago concerning the true time, and maybe we do clarify, is there a problem with people not clocking in or not?
Can we talk about that after?
Yeah, but what I'm saying is, if that is a problem, then it needs to come back to us where we can address it in some way, or make up something where if people are refusing to use the clock in, then we need to, as a board, decide how we're going to address that.
They're not signing in every day.
Well, then you've given them to the 10th to start doing it, and if they don't, then by all means, feel free to bring that back to us, and then we need to decide what needs to be done to where it helps you to facilitate them. Because that's the whole reason we got
We've had it an entire year.
we have, and I mean, people are human, people make mistakes, but if it's a habitual act, that's not a mistake, it's done on purpose, it's cheating the district, and at some point, as a board, we have to put something in place that deals with that. And again, I just want you to know, as chairman, I've seen you send out numerous emails concerning this, and you've tried to be nice to people about clocking in. And I mean, if someone didn't get paid, then they're going to be wanting to know why they didn't get paid. And I would think if you didn't clock in, then that would be grounds of not being paid, or at least having to use your comp time or personal time if you're not here. But that's my only questions or concerns I have concerning the email. I just don't want you to, I mean, you've given them to the 10th, and if they choose not to do that, then it needs to come back to us, and we need to decide how we're going to deal with this, in what way. That's all. Is there a motion to adjourn?
I made a motion to adjourn.
Yes, ma'am.
One reminder that next Monday on the 13th, there will be the final term budget meeting.
Okay.
And also we should have the annual financial report ready to present to the board as well.
Okay, so Monday the 13th, we have the trim and the financial.
What time? 6
Yes,
o'clock?
and the bargaining committee has presented a couple of options that the attorney said we need to present to you. So we may need an executive session after that.
That will be fine
Talk about
if Miss Bishop could advertise that.
You don't have
The
to,
executive
Section.
session like that.
Well,
the trim.
the trim. Will Monday be Monday? Everyone
good with me.
knows about the trim and the executive session following the trim.
Will the time still be at 6 o'clock?
6 o'clock, right?
It's advertised at 6 o'clock in the county.
It's okay.
Okay.
Okay. Well, thank you, Ms. Rainick. Is there a motion to adjourn?
I made a motion to adjourn.
It's been properly moved by Ms. Bell. Is there a second?
Second.
By Ms. Gibson. All those in favor, show of hand, please. 5-0, Ms. Bishop, for adjournment.